We're joined now via Zoom by Kirsten Tennent, is brand manager at Dove. Good afternoon to you, Kirsten. Thank you so much for joining us here on the SABC News channel.
Thank you for having me.
All right, so let's just get an understanding of this Courage is Beautiful campaign. What exactly does it entail?
So it's a campaign that we have put together to really hero healthcare workers. So as you mentioned, healthcare workers are under a huge amount of strain. And I think because there's so much going on at the moment, we just wanted to hero healthcare workers and really kind of bring them to the forefront and really let people know how amazing and the amazing work that they're doing, just so we can all really appreciate the fact that they are really putting their lives on the line every single day.
So we know that the campaign has been in operation for a few months now. What are the healthcare workers saying? What are they telling you?
So we did a bit of research beforehand to see, as Dove, what can we offer healthcare workers that will be the most meaningful and the most helpful to them. So we conducted some research. And what came out of that research was that the mental strain is one of their top concerns. So what we're realizing, and in relationship and in working with the Department of Health, we're realizing that healthcare workers need access to help and support so that they can process what they're going through, so they can speak about it. I think one of the most important things when you're dealing with this kind of stress and strain is to be able to debrief and talk about it and work through it so that you're not on your own. So that's really what healthcare workers are saying that they require and what they need. And that's really how we want to be able to help them.
All right. So basically you providing that mental health support to all healthcare workers.
Yes. Mm-hmm. There's a toll-free number that they can call 24 hours a day, absolutely free, no cost to them at all. For healthcare workers and their direct dependents, for anybody who lives in the home of a healthcare worker, because we understand that the entire family is being affected by the fact that the healthcare workers are needing to go into work and potentially, what they're exposed to is something that they could also bring home. And this is unlike almost anything that a healthcare worker will have had to deal with in the past, because it really could infect them. And then, the mental strain in terms of having to then be careful because of their loved ones. So this line is available to healthcare workers and any of their direct dependents.
And what have your observations been in terms of the response from this toll-free number? Are they really using it in their large number? What's the response like?
So the line has only been available for the last 2 weeks, and then the line will be available until the end of the year. So I think the biggest kind of insight that we have is from the Department of Health, who say that this is a need, and then we'll see as we go, and we'll be able to also adapt our offering, I think, as we go. What we've heard already is that debriefing sessions are very important. So we're already seeing how we can change the offering just from a standard toll-free line that you would phone with your general mental health concerns and anxieties to a real debriefing session. And the importance of that is that if trauma is not addressed within the first 3 to 5 days of somebody going through something very traumatic, that can turn into much bigger, longer-lasting psychological kind of disorders and issues like post-traumatic stress. So we'll see as we go how the need adapts, and we'll rise to the challenge and we'll help healthcare workers in the way that we can.
And I think this initiative once again highlights the important role that businesses can play in times of crisis such as this one.
I agree. And I think lots of businesses have stepped up, and a lot of businesses we've seen are helping financially and are helping with PPE, and those are really, really important. I think for Dove, what's really important is that we've always really wanted to help in terms of self-esteem and anxiety. So what we've realized is that this mental aspect, as well as the physical aspect, this mental aspect is so important. So this is really where we're hoping to make a big difference.
All right. No, thank you so much for joining us this afternoon. So are you also donating products as part of your care and support program for those who need it during this time?
Yeah, we are. Again, in relationship with the Department of Health, we've made a lot of Dove product available as care packages. So another way that Dove is saying thank you and honouring and heroing our frontline heroes and the people that are there for us every day.
All right, Kirsten Tennent is brand manager at Dove, talking to us about this campaign that's aimed at helping your healthcare workers. The campaign is called Courage is Beautiful.